Hi guys and welcome. This is Jen Gaeta Siciliano, artist, memoir writer, bipolar psychiatric survivor, and your host of Not As Crazy As You Think podcast, the place that offers an alternative perspective on mental illness, highlighting creativity, non-conventional healing, and breaking on through to the other side. If you are ready for a new narrative on the mental realm that celebrates crazy and cool without penalty, then Not As Crazy As You Think is for you. Hello, this is Jen Gaeta Siciliano, your host of Not As Crazy As You Think podcast. I am absolutely thrilled because today we have a real powerhouse guest. He was willing to come on and share his views, and he has a lot to say. His name is Dr. Roger McFillin. He is a licensed psychologist and executive director of the Center for Integrated Behavioral Health in Bethlehem, Pennsylvania. He is also host of the podcast Radically Genuine. He is strongly committed to the use of evidence-based treatments and specializes in cognitive behavioral therapy and dialectical behavioral therapy for the treatment of post-traumatic stress, eating disorders, and mood anxiety-related concerns. I came across Dr. McFillin on Twitter, and he is a challenger of the system. We need so many more voices of his out there. And with his voice paving the way for us psychiatric survivors and other people who are wondering if they should enter the mental health care system, I'm just so thrilled because he's giving legitimacy to millions of people who are claiming they're suffering from prescribed harm. So thank you so much for joining us. And please, I'm thrilled. Thank you.
Jen, it's an honor to be here. I really do appreciate the opportunity because it gives me the chance to tell my story and what I've observed in the mental health system as a practicing psychologist and even prior, and to talk about everything that I've learned from the scientific literature that exists out there and what is often kept outside of the mainstream narrative. And part of my mission right now and part of the mission of my podcast, Radically Genuine, is to discuss a lot of this information that is really kept from us because it's not part of the medical establishment's identification of like what is mental health or mental health related illnesses. And stories like yours are critically important. And we do have to legitimize the consequences and the harms of psychiatric care in the modern day mental health system. And we can only do that if we come together as a community and share what your experiences have been and the experiences of others, and then connect that with sound science, because the science is pretty strong as well. And then we can, I think, regain as a community and being able to expand our understanding of what it means to be human and the struggles that we all kind of go through of living and the challenges that some may go through that really deviate from what is considered normal. And then most importantly, how do you recover? How do those who do struggle with conditions, whether that's, severe kind of depressed experience or experiencing psychotic episodes, how do they ultimately recover? Those who have been exposed to traumatic situations and experienced post-traumatic stress, or those who just find themselves like stuck in life in various problems or addictions, whether it's with drugs, alcohol, or food. So part of my mission is to be able to help kind of articulate what we do know and what we don't know. And I do appreciate the forum.
See, this is where it's at, right? I mean, what is really going on through the science? And I appreciate your take because, not enough mental health professionals are having this conversation. I think for fear of losing their, credibility in the system or, professionally. But I love the fact that you have a background in being inside a psychiatric hospital, a children's psychiatric hospital. Can you tell us a little bit about that and what you experienced?
Yeah, a lot of people who I end up meeting, some of the first questions when you meet a psychologist, they might ask you, well, why did you become a psychologist? And I often answer that question that I don't think that when I was younger, that my life goal was to become a psychologist. I think I was in a lot of ways born to do this. And there's been a number of experiences that have been placed in my path. My first was getting out of undergrad. My first job out of my undergraduate program, I worked in a children's psychiatric hospital. And it was ages 5 to 10, so very, very young. And as you could imagine, many of those young children were coming from very adverse situations, abusive, neglectful environments. And they were acting out aggressively in school or in other situations that led them to be psychiatrically hospitalized. And for somebody who was just untrained at that time, there was just being a human, you could see the fear and the pain in young children. And there's an innocence about kids that help you kind of see beyond what might be a label or a diagnosis that was placed upon them at that time. But it was my first experience into what is modern day mental health care. And I was appalled. I would see less than a 5-minute interview by a psychiatrist, basically asking these kids, what's their name and why are they here, with a psychiatric evaluation being written up off of just that information or other information that was presented to them in a very short amount of time. And then the treatment was typically multiple psychiatric drugs. So I got to see 6, 7-year-olds diagnosed with bipolar disorder or psychotic disorders, when it was very clear that they were responding in a way that would be considered normal given the abuse and the neglect that they experienced. And the response to psychiatric drugs in that environment was, I could best describe it as just sedative. So they were sedated children who in a 7 to 10 day period would obviously decrease their any physical aggressive behavior because I think they were sedated. I would see them sleeping 16 to 18 hours in a particular day. Yep. And I would just ask questions because just from a human perspective, it didn't make sense to me. That didn't seem like healthcare. They weren't being stabilized. They weren't being accurately understood. And initially, those first couple of days in a unit, these kids would be quite aggressive. So there were a lot of like tantrums or outbursts or even aggressive outbursts. And you were taught on the unit to place them in holds, like physical restraints, and then take them out to what was called a timeout room. And just by my nature about, just I think who I am as a personality, I just refused. I refused to put kids in psychiatric holds because you're in a lot of ways, I think you were just kind of reinforcing the idea that adults will hurt you physically. And I decided to kind of do things on my own outside of how I was trained, which certainly led to, in the beginning, me kind of getting kind of written up and questioned. But what happened in time was that I would kind of tell these kids, I'm not going to hurt you. I'm not going to harm you. This place is safe. And I would get a very different reaction from all these kids. And I had like a real control over a unit of 5 to 10 psychiatrically admitted children who were aggressive. And it was just based out of kind of presenting to them in a very non-threatening way. I quickly got promoted. Again, I'm in my early 20s, and I got to be part of these treatment team meetings with psychiatrists and social workers. And I just observed how those who were working on that unit and in those meetings just followed whatever the psychiatrist stated. The psychiatrist stated, let's up the Seroquel, let's up the Depakote, let's up this. They accepted the diagnosis. There was a hierarchy where the psychiatrist could not get challenged. And, I was taught at a very young age to challenge authority. So I challenged.
Wow.
And I asked questions. I said what I was observing. I thought children were being deteriorated. Were deteriorating on the unit when others were saying they were improving. And I presented that with my clear observations and my evidence on the quality of their life and how they look sedated. I asked questions about the accuracy of the diagnosis, about what we know about the drugs. And you learn very quickly how little they knew.
Yeah.
And why they chose the drugs they chose or the diagnostic system. And basically, Jen, it started a series of steps in my life to eventually go to graduate school and then to a doctoral program and to become a clinical psychologist. And I'm curious by nature. I investigated into the research literature, and I cared very much about actually what works. It took me down a rabbit hole in so many ways, where you just saw financial conflicts of interest and fraud in the clinical trial and data. And you realize there's so much we don't know. You get to understand how diagnostic statistical manuals were actually developed, how poor science exists. And we don't really, we are in an infancy stage. It's very, very primitive. These psychiatric diagnosis based on reductionist models of biological theories in so many ways have never been able to pan out, no matter the millions of dollars that we've been able to throw into the research to try to identify underlying brain abnormalities or chemicals. You keep coming up against a dead end, so much so that it's kind of been abandoned. But yet we still live in this culture where the messages are pharmaceutically driven, based on nothing more than, old theories to try to support the marketing of their drugs. And here we are in 2022, and we're 30 plus years into kind of this scientific advancement into understanding mental health conditions as brain disorders, and people are just becoming more and more harmed. And we're seeing the long-term impact. And that's to put it in a nutshell, that's kind of where I'm at. I'm at a point in my career now where I want to publicize this. I want to make it more mainstream, and I want to talk about what works.
Wow. I mean, that's huge because, again, as a mental health professional, and I subscribe to therapy. I mean, I have a therapist, and I believe that there are so many ways to heal. I don't believe psychiatry and their approach through labeling and drugs is the way to heal. In fact, it is doing so much harm. And you speak about the science. How are these studies being conducted? And I talk about this a lot, but I want to hear it from you for our audience, because you're a professional, you're in the field. I'm the one that's, fighting because I don't like it, but because I'm at the hands of it. But I want everyone to know exactly what is left out. What is the scientific basis to support this efficacy? How are these studies conducted? What are the placebo trials telling us? Speak to that a little bit.
Yeah, it's a good question. And, I honestly get kind of choked up every time I begin to talk about it, because the antidepressant drugs, for example, SSRIs, are a multi-billion-dollar industry, with 80% of them being prescribed by pediatricians or primary care settings, where they're not trained to accurately understand the complexity of presenting mood problems and other common emotional problems. And these drugs are being prescribed at astronomical rates, and have increased dramatically in the past couple of years. And really, they're making their clinical decisions and prescription recommendations off of nothing more than pharmaceutical marketing pamphlets and information. If you want to look back into the trials and how they came to market, let's just start with the antidepressants, because they're so widely used now in society. The pharmaceutical industries, understood one thing quite early, that they really could not distinguish these SSRIs from what would be a placebo effect. Mm-hmm. And so in order to be able to bring these drugs to market, they set up their trials in specific ways. So the most important thing that people should know is the overwhelming majority of these drug trials are very, very short, 6 to 8 weeks. Okay, so that in itself, we should understand that they have no interest in really understanding what the long-term impact of the drug was. And when it comes to mental health, and I see this just as a psychologist who provides cognitive and dialectical behavior therapy, just having a connection with a professional is going to yield some sort of short-term effect, right? So if you're not feeling well and you do something about it, whether you go on a drug or whether you go meet with a professional, there's going to be some short-term mood boosting or elevating effect, because there's just personal connection and intention to do something different. Mm-hmm. And traditionally, most Depressive episodes, for example, are short-term. They're episodic. So there's a beginning, a middle, and an end. So there's going to be a percentage of people that, you're facing an adverse event or a setback in life. You might get depressed, and then it resolves itself in time as their circumstances change. And that's why we have to set up randomized clinical control trials to try to be able to determine, is it the drug, is it a placebo, or is it something else? And in these trials, blind was broken. And basically what that means is the people who were taking the drug knew they were taking the drug because it alters your experience. Anyone who's taken an SSRI, many of you will know that you feel a bit different. Mm-hmm. Many people don't feel anything. Some people feel horrible. Other people just feel what's best described as kind of an emotional numbing, or they just feel a bit disconnected or different. They knew that they were on something. So right there, blind is being broken, and they know that they're being provided the active drug treatment. And even then, the difference between placebo and those who were on the active substance was quite small, statistically small. But you can identify a statistical difference between the two groups based on the measures you're going to utilize. So if I would give a measure based on depression, and I have two people who are very severe, you can have a short-term reduction in those symptoms, but it not really mean anything clinically. Mm-hmm. So what we saw is that in some of the trials, they were able to identify a small statistical difference between the groups, enough to publish. And when there was no difference, they just didn't publish it. So it's the file drawer effect. And finally, what I think is also important in understanding this is there are people who had just some really strong adverse reactions, even suicidal, and they were kept out of the trial data. And then people, more complex cases were kept out of the trial data. So you can selectively choose your patients. There could be statistical gymnastics. And this is widely kind of known for those who've kind of went into the literature. There's people around the world who have written papers on the limitations of these trials. But what the drug companies did, which was brilliant, was what they did is they hired academics to ghostwrite the papers. So the academics didn't get to really have anything to do with the development of the trials, or even the data was just provided them by the pharmaceutical companies. They wrote the papers, which provided them legitimacy. If I can have an academic publish the paper, now they're on the payroll for the pharmaceutical industry, and they develop careers around this by going around speaking, talking about the papers or their data, promoting the drug, and they make a really, really good living. Wow. You combine that with devoting so much money to advertising dollars. You go back to the 90s and the 2000s, and the American public was just bombarded with these commercials that suggest what you're feeling is based on a chemical abnormality. Right. And they believe these drugs correct that abnormality. And then they use what amounts to, I think, just fraudulent data and poor methodology to say that there's a statistical difference. But it's widely known that these drugs don't do anything to improve quality of life. And the long-term, health effects of these drugs are really concerning to us in the field. Right. I'll take it one step further. I also care about the psychological impact of this marketing propaganda. Mm-hmm. The idea that your entire emotional experience is outside of your control, right, or your behavior or what you feel is outside your control, and it's not connected to the complex factors that are included in living life, from our relationships to the food we eat, to our exercise, to our purpose, to our economic situation, to dangerous situations, to traumatic events, to our health. All the complex factors where how we feel is supposed to really serve us evolutionarily in order to make changes. You become reduced to saying you have a disease state, it's outside your control, take that drug. And I believe that that's brainwashing.
Right.
And before you know it, it's impacted what amounts to be generations now, Jen,
Yes.
from this marketing. And so anytime that young people, and young people are most at risk because these drugs seem to even have a worse effect on them, increased suicidal rates. And I think there's good scientific data out there. I'm bringing an individual on my podcast, and case studies exist where they can even induce homicidal reactions.
Wow.
So very simply, the medical establishment and the medical community has completely overestimated any benefits and then underestimated any risks. And really, I think it's pharmaceutically driven in their combination with aligning with academics and the major media outlets in the United States and through advertising dollars.
It just seems so corrupt. I mean, when we really do get to the heart of it, because there's so much money at stake, there are professional status issues. And, there are the rest of us, like, who I fall into that category, which is so brilliantly conceived, that I am forever mentally ill, which is the most ridiculous thing. I never bought into that ever. I never even understood that concept until it was presented to me in 1994. I mean, like, I didn't even think that anybody could be ill like that forever, but this is their narrative. And the fact that they did all these trials, that they only tested for 8 weeks, when they subscribed them for life to many of us, okay, people who are having any kind of psychotic issue or any kind of extreme emotional state, they are basically saying that you can't get over this. You talk a lot about resilience, which I think is so important. And I always, always, always believed in that. So when they started spewing this to me, I would be like kind of the smartass on the other side. Like, I don't believe that. And one of their approaches is, well, we're going to force you to believe it because then that means you're getting better. And that's their indication that people are improving. A lot of the times, if they finally buy into this, they are saying that this is scientific. This is instead a massive brainwashing scam. And, frankly, a lot of the people who are affected by this are people who are on the outside of society, a little bit on the, fringe thinkers, out of the box thinkers. We might challenge, we might have attitude problems. They always would point to that with me. This isn't enough to say that we're sick forever. Can you speak a little bit to how we might be able to regain this idea, if it can return, that we can recover from states of distress? We can be resilient. We can be our own healers and pay attention to our feelings and use those feelings to guide us into a better state of mind.
Yeah, it's a great point. And I think, your experience is not that dissimilar from many. I have an interest in history. So to me, I like to try to examine the best I can kind of historical data. Because right now, every kind of measurable statistic would say the rates of quote unquote mental illness, although I hate using that word, are so dramatically and statistically higher than any other point in history. And when you start going back, let's just take something like what we call now bipolar disorder, or used to be called manic depressive illness. If you look historically, 50s, 40s, 30s, these were very statistically rare events. And most people who experienced them experienced only one episode and then never experienced another one. It's only when we ended up kind of exploding into this drug era and DSM era where we started to look at mental health conditions as chronic. And they've become chronic. But it's my belief, I think the science supports it, that the chronicity of the disorder is directly related to how it's treated. Right. So the drugs will create what was initially an episode that could have been treated differently, and it's created a kind of a lifelong illness based on the effects that it has on the body. Same thing with just depression, or what used to be called melancholy. What is like commonly, identified now as depression is nothing more than typical adaptation of the human experience. It's now for the first time just labeled as an illness or a disorder, and that the reason that's just a consequence of this widespread marketing and propaganda. Kids today don't even use the word sad. It's like anytime you even feel sad, you just label it as depressed. So there are situations that we really don't know a whole lot about. We don't know why someone's schizophrenic, and we don't know much about chronic mental illness, and that has always existed. So I don't want to discount that like severe and chronic conditions do exist, but I want people to understand that they are statistically, historically quite rare, and we see no improved outcome with any of the psychiatric drugs. In fact, there's really good evidence that we're harming the long-term outcomes by use of these drugs. Most of what people are drugged for and labeled for are the normal variability of human experience. Mm-hmm. So one of the things I'm open about, I think for the first time in history, we are drugging the creative. We are drugging the artistic individual, the spiritual individual, people who experience their emotions intensely, who experience empathy intensely. Obviously, if you are conditioned to believe experiencing emotions as a symptom, and the more intense they are, then you are at risk of judging that experience as if something is wrong with you. And I see it as a gift. My perception on this is that experiencing your emotions intensely is a gift. Can it feel like a burden at times? Certainly it can. When you're rejected, when you're struggling, when you're feeling lonely, obviously experiencing those emotions quite intensely can feel quite like an emotional burden. But I also believe it's within everybody that they have the capacity to be able to build skills and experience of using those emotions to their advantage. I'm a big believer in evolutionary adaptation. I think our emotions are gifts from our ancestors, and the range of human experience that we have are meant to serve us. I believe in the natural resiliency of all human beings. Being on this earth and living this life comes with pain, and it comes with lessons, and life is its best lesson. And I want to move our culture away from thinking about how you feel at any given period of time as it's somehow representative of something wrong with you personally. Everything is quite right with you. Even if you have gone through some traumatic experiences, your reactions or your responses to that are to serve you. That doesn't mean you can't get stuck. That doesn't mean that your life doesn't become restricted, or you can feel really bad or even question the purpose of your life. What I'm just sharing with you is don't think about that as a disorder. Don't think about that as an illness. And don't think there's a pharmaceutical out there that's going to change it, that you have it within you. And families of those who are suffering have other avenues and opportunities to look at these experiences differently, ones that are grounded in pretty strong historical and scientific data. There's a trauma-informed movement that exists out there that just tries to depathologize and demedicalize natural human responses in support of that. That's not to diminish that one's coping reactions or responses could create lifelong struggles without professional support. I'm a psychologist myself. A lot of my clients that I work with are survivors of some sort of traumatic event. I work with rape victims, childhood physical and sexual abuse victims, those who have been victims of crime, or have even served our country and have had to face life and death situations in combat. The reactions to all those events can make it very difficult to adapt back into society. I just believe and know through our literature and effective treatments that people can recover from that. So part of my mission is to demedicalize and pathologize and move more to understanding things from what I fully believe to be a more grounded and scientific perspective, that much of what we experience and what we feel is a normal and expected adaptation to our lives. In modern society, I think there is certainly a mismatch between modern living and what we're kind of genetically designed to actually do and live. We're becoming much more socially isolated. living in screens, exposing ourselves to iPhones and social media. And we know the negative mental health effects of living that way. We're social creatures, and we're meant to be connected, and we're meant to be connected with nature and to move our bodies and to eat good foods. And the more that we limit how we view our own mental health, and we disconnect it from all these other important variables, the more we're moving in a direction that doesn't help us solve problems when we face them. I mean, there's a number of things I've had to do in my life to be able to adapt to circumstances and try to feel as good as I possibly can and be the best person I can be for my clients, for my family, my children. And that is the way I take care of my body and my exposure to sun, and committing to meditation in my life, and the diet that I eat, and the amount of sleep that I get. We don't get to talk about all these things, nor are they assessed or evaluated in the typical medical mental health system. It's 15 minutes and a prescription. So, I want to be outraged, and I want my outrage to be able to make a difference for people who are struggling, because there's just a better way.
Yeah, absolutely. And the thing is, you mentioned all of these lifestyle choices that we can make. This conversation needs to be had. I mean, I'm a Gen Xer. Okay. So we were put in the world, and there didn't seem to be much of a difference that we can make if you didn't fit into the mold. So many of us were, what do they call us? The slackers. And it was said at that time that the slacker generation were the mentally ill. Okay. So it seems as though, like, now, since that time period until now, we have so many people who we've put into this category, where we've explained to them, this is your problem. This is you're going to be your future life. You're not likely to succeed. You're not likely to break out of this. This is how we can help you. And it's just keeps sustaining itself without the conversation, as you say, social media, nutrition, sleep, all of these things. I know when they kept pushing for this narrative with me, I said, I don't buy it. I know I don't get good sleep. I know I, do A, B, C, and D. Maybe I can prove those things. Maybe I can start exercising. I had to, after years and years and years, decades of just, going to the doctor because I was forced to go, because if you don't do it, especially as a bipolar, you're considered non-compliant. You can have forced AOT. You can, be forcibly drugged. This isn't the way that proper, I don't think, mental health is what it's about. Mental health to me means thriving. It means growing. It means expanding. It means getting better. If you are touting that, okay, well, we're the mental health experts, but you don't provide any strategies as to how to reach a place of sustainable mental health, then you're part of the problem. So I know that, hearing what you have to say, you do know that there's other strategies that are better, that there's other evidence-based treatments. So now, if we know that these treatments that are being given with drugs and long-term drugs are not doing the job, what are some evidence-based treatments in therapies that do work?
Yeah, it's a good question. And the way that I like to think about it is, what are evidence-based principles and how are evidence-based principles applied? You're just telling your story about your experience in what is modern day psychiatry. And by no means does that reflect evidence-based medicine. I think any evidence-based practice and evidence-based medicine has to be, it has to implement the best available evidence, and it has to have the best of evidence-based treatments, and it has to have a way of monitoring your response to the treatment over time. Mm-hmm. And I don't know, Jen, how you can treat something without understanding the cause. right? So, like that's, I think, the real kind of mind fuck of like being in the modern medical system, mental health system included, is we treat a lot of symptoms without understanding its underlying cause.
Mm-hmm.
So, I want to get back to a restoration of understanding that what we're feeling, whether it's behaviors or thoughts or emotions, they're a response or a reaction to something. And we have to understand what that something is. So let's take something like bipolar disorder. I don't deny the fact that what is identified as mania exists in the human experience.
Right.
What I ascribe to, though, is what causes mania is much more complex than what is now identified. It's not just this brain chemical abnormality that you need to be on a drug for the rest of your life, or you're just going to have mania after mania after mania. There are so many different causes, most of which we are unaware. Mm-hmm. So I was talking to you just before this podcast began, and you just talked about exposure to a medical illness. Being really sick can induce mania.
Right.
Being sleep deprived can induce mania. There could be reasons that our limited human minds of where we are at this point in human evolution are not even close yet to connecting with.
Right.
How about some humility? Mm-hmm. Look back in history and how we have evolved. There is always a time where we think something to be true turns out where it's not true. And we just look at ourselves as so primitive. How could we treat people that way? Mm-hmm. How could we use electric shock treatments, or not understand, how germs can create disease, and, how can we burn witches at the stake? Let's have some humility about where we are in human evolution, that the experience of a manic episode could have so many complex and multiple causes, and we should dedicate ourselves to begin to understand it. Now, can some form of a drug maybe stabilize somebody temporarily? Yeah. There's some like induction of a pharmaceutical or a drug that could have some temporary effect. It could stabilize some people. But these drugs aren't medicinal. They're not correcting a chemical imbalance. They're inducing a chemical imbalance. So to understand why someone might have had a manic episode is for us to better understand all the factors about that person's individual life, their biological, nutritional, relational, spiritual experience in this world. Now, back to your question about evidence-based kind of treatments and treatments that work. The overwhelming majority of people seeking out mental health treatment are dealing with mood-related problems and fear. Mm-hmm. So they are struggling with low mood, loneliness, irritability, low self-esteem, challenges and setbacks in life, grief, loss, worry, fear. That's what drives them into the modern mental health system. Right. And we do have evidence-based principles that exist in effective treatments for those conditions. Many of those emotional experiences are part of living, but they also can drive people into problematic behaviors as a way of coping with them. Examples include turning to drugs or alcohol to feel better, mm-hmm. turning to hurtful, harmful relationships to feel better, turning to food, restricting food, self-injuring, gambling, you name it. How we respond to our own internal experience, thoughts, emotions, the pain of living, can lead us to either on a path to where we're using those experiences to enhance our quality of life, or are we on a path where we're trying to avoid that experience, just try to feel better. And we fall into patterns over and over again that create more distress and problems. Mm-hmm. I think evidence-based principles that exist support this identification of human resilience and adaptation to stress. Whether you're a rape victim or you're dealing with loss, we know that being able to emotionally process and face what just happened and to learn from it and to choose our next step wisely in order to create the life that we want to live is effective. Right. We know that we can respond to painful memories, to judgmental thoughts that lead to biases and attention. If we're socially anxious and we're worried, there's strategies and ways that we can learn to manage that experience and devote our attention and focus back into our life. Exposure-based principles of treatment work. There are good established treatments for post-traumatic stress conditions like prolonged exposure and cognitive processing therapy. There's good established treatments for bulimia. There's strong treatments for depressive episodes. They're non-pharmaceutical. They're much more effective than any drug. They're just not widely disseminated. In my practice, we have comprehensive dialectical behavior therapy for people who experience their emotions quite intensely and struggle with fears of abandonment and might self-injure or have multiple suicide attempts. And you're learning skills to become more mindful and tolerate distress and interpersonally effective and learn how to regulate your own emotions and tolerate distress to prevent those problematic behaviors. It's delivered in a way that extends what is beyond what is the typical mental health system. Skills training groups, telephone coaching, a supportive psychotherapy. I think there are innovative treatments that are also outside the mainstream when it comes to understanding metabolic health and nutritional psychiatry and how the foods we eat create reactions in our body that mimic psychiatric conditions. There's just a wealth of information, Jen, out there. I could do 3 or 4 hours breaking down every kind of evidence-based non-pharmaceutical treatment for the common presenting problems that exist that could really inform a higher quality of life. They're just not widely disseminated or distributed. And most mental health professionals aren't really trained even in this area because that's how much the medical model and the pharmaceutical and DSM model of care has dominated the training, the academic training, and our modern society in the past 30 years. Right. It's going to take a tremendous movement for people like me, other like-minded professionals, as well as those who have not, at best, experienced no improvement by going into mental health care, and at worst their health has been destroyed and have been harmed by these treatments. Yes.
And I'm sure that you have now come across many more people who are in that category because we're starting to finally talk about it. But there's so many of us. And, I want to speak to all the things that you've just brought up, because one of the things that I try to push out there is that I am pro mental health. It's not like I think that it's a very important thing that we should all strive to it, but it's totally achievable. And it's an ongoing thing. I mean, it's like you have to take care of it like you take care of your physical body. We know that alternative treatments work in many physical illnesses, right? It's not everybody wants to take a drug. So they might improve their diet, they start exercising, whatever. But it seems so strange to me that somehow the world of the mind, this ethereal, this non-local area, that somehow we got everybody fixated into thinking that things that are, in the realm of ideas and feelings are somehow trapped inside the locale of your brain. And that materialistic approach is the problem, because if we were just looking at this as an integrative way to have a healthy life, mind, body, spirit, everyone talks about these concepts, but when it comes to mental health, somehow there's a line. And it's because, like, as you said, this brainwashing, mechanism, and it incorporates a lot of areas of profit, really just pushed out such a forceful game that it's so hard now for people to say, oh, okay, well, yeah, that also includes mental health. The mind, body, spirit balance also includes mental, like, how could it not? So, my issue is I'm also I teach also, and I'm around a lot of young people all the time, and I feel for the parents today, because when they struggle with something that their child goes through, it's overwhelming. It stops everything. You would do anything to help your child heal. But the problem is, I know at least where I live in Westchester County, which is very rich. And it's a lot really where, I mean, I'm not rich, but it's like a rich area where a lot of psychiatrists do live. And there's a lot of activity in that field here. So I feel as though that is always the first course of action. And that to me is a problem, because other things are not on the table out on the outset. As you said, a lot of the times it's like a 15-minute conversation. They don't really go into, the family dynamics or, habits that the kids are forming, or, what they're eating, all of these things. And the parents want to do what's best. So when there's so many kids being affected by this, like, how does the average person who is realizing that maybe they, people who are fighting against this system, they have something to say. Maybe this does make a little sense. Maybe we shouldn't be drugging the kids so young. How can we get people to hop on board to this new message?
Well, podcasts like this, podcasts like mine, social media. I mean, we have a way now to communicate instantaneously with people around the world. Social media can really advance the conversation. Obviously, social media can be harmful too. We live in a divisive culture, but there's a real benefits to being able to share information and communicate with people, around the world. So I do think those are important avenues. I thought you brought up some really good points when you were kind of thinking about modern society and talking about mind, body, and spirit. I've been reading a lot about recently on just Stoic philosophy. And you realize that throughout the course of human history, we've struggled with trying to find purpose and meaning in our lives and to feel good. It is what's common amongst all of us that we're going to feel pain and it's going to be difficult. Life is hard. I always believe that life is is their best teacher. And I personally believe that there are lessons for us to be learned. The pharmaceutical industry and modern day medical establishment have kind of like hijacked, our generations of kids to try to think about that differently. There's always going to be a search for meaning. There's always going to be a try to feel better. And now they're just trying to financially benefit from our own struggles and fears. So if we're going to be able to make changes, we do have to normalize the challenges and difficulties of living,
right?
Because that's kept outside of the mainstream narrative and lexicon. You start thinking about, it's almost a byproduct of modern day capitalism that you're exposed to Hollywood and these social media apps, and they send this erroneous message about what is happiness, and then it's based on materials and achieving certain things. And it's almost like the common state of being in this world should be happy.
Right.
And we as psychologists know that is not the common state of the human experience. What we feel is much like the weather. It's always changing. So when you have a stormy day, if you're thinking it through the lens that there's something wrong with you for feeling that way, imagine the consequences of such a judgment. Then you begin to examine all internal experiences through this lens that there's something broken within you. Obviously, that drives you to the quick fix. And the quick fix is to buy something or to take something. And industry certainly is going to benefit off of your fragility and your fear and your struggle. And a material culture is going to say, hey, if you look like this or you buy this, you're going to feel better. And ultimately, that's not going to be the case. You're going to feel empty. That's not how you feel good and happy in this world. And we have to, this kind of secular society that we live in, most people believe that there's something greater and beyond us. And so we have to connect with that idea spiritually. I can see the harms of organized religion and talk about that, and still also be able to kind of express that a lot of people feel that they have a connection to something bigger or greater than them. And that is meaningful. And we have to embrace that. And there are universal teachings documented throughout human history, whether that's Jesus or Buddha or other people from other kind of faiths or backgrounds that have some universal messages around love and around dealing with the distress and the struggle of living. It's important for me to advance the conversation on the complexity and the challenges of living, and not to simplify it, because that's gonna take you down an avenue of looking for a simple answer to complex questions. And before you know it, you're drug dependent, or you're on multiple different drugs, or you're seeking everything from the outside, and that's just not how you're going to feel good.
Right. It's true. You bring up this idea that it's really the thinking, right? It's the way we think about life and the human experience. And then therefore, what choices do we make because of the way we think? So if everything is now encouraged, or we are encouraged through many scientific principles, I guess, to look at things in a rejectionist way, then that means like, okay, well, everything that we once learned about, that would support something else, which, would point to, okay, well, there might be some other influences at play in life to teach us lessons, or anything that would be outside the realm of, black and white or cause and effect. It all of a sudden becomes like, well, that doesn't matter. That search for meaning doesn't matter, and that's everything that matters. That is the thing that matters, because that's directly affecting our thoughts and our feelings. I mean, this is what drives me crazy, because the thought, the feeling, that is part of the essence of our minds. And when you reduce the mind to just this idea of, function, dysfunction, chemicals, we both know that the chemical imbalance thing, as you mentioned, is just out the window. But these narratives have been so pushed out there that as much as I talk about this stuff, even some of my friends, they're like, you know what, I remember somebody just recently said this to me. They're like, you know what, I just got to go on something because I know it's my chemicals. I'm saying, well, you stop that. Like, why? What I do, what I say. How could you buy into that? I know, but it makes sense. And it's only because they want a quick fix,
Yeah.
and I'm not, listen, I know, if somebody wants to have a joint, if somebody wants to have wine, that's a quick fix in a way, but it's not long lasting harm. And the reason why I feel the psych meds is a huge problem in our society is because it creates not only a sense of dependence, but a literal dependence where you can't just get off these things easily. There have been several times once when I was pregnant, another time I tried, and failed to get off these things. When you try to get off them, you suffer major brain, a nervous system damage. Okay. And you can't just bounce back on your own. So I just want to go over this again because it's so important for people to really understand this. They do the trials for 8 weeks. They put them on for life, and they don't give you any exit plan. So why would you get on it? You know what I mean? It's not a proper choice. And yet it is the responsible choice, quote unquote, that they're pushing as a field who are there to save you and to we're there for you. You need to find help. And that's one of the reasons why a lot of people refuse to go for help, because they don't want to be pushed into being on drugs and being in long-term care. I mean, this is a system that is so broken that even when we discuss it, it makes me, it just makes me feel that the way to heal is to completely reject it. Now, let me take a step back. Of course, when people suffer mental distress, I am always encouraging them to get some kind of help and to get some kind of therapy. But therapy is across the board in so many different ways. And I do believe that finding the right person is huge, and to never give that up if you feel you're having a struggle. So I don't want people to feel like I'm just, anti help in the mental health professionals, out there. But we need to call upon them and say, this is what we need. And yet when we say this is what we need, and I know that the land of the social media land and Twitter, where there's the prescribed harm community, there's the psychiatric survivor movement, there's people who are anti-psychiatry, who are psychiatrists, and we're not going to go into anti-psychiatry because that has a history of connotation that we don't need to go there. But the thing is, they're so defensive, a lot of the psychiatrists on and you've experienced this yourself with people backlashing towards comments that you've made. They're so defensive, and I'm thinking to myself, and when I read what they say, who are they doing this for if they're not doing it for their patients? I mean, if patients are saying we're harmed, why would you make fun of them? There are people who are psychiatrists on Twitter that make fun of people who are calling out to be heard about prescribed harm. Can you speak to any of this and the backlash that you've experienced?
Yeah, I think the situations that you're describing about psychiatrists who are defensive and who are actually making fun of patients who've been harmed by the treatments, they're the worst of the profession. I don't think it is fair for me to characterize or generalize that is typical. I think that's actually atypical. What is more typical are people who enter into medical school and in some way find themselves either pushed into psychiatry outside of what they initially intended to do, or that they develop some sort of like passion for trying to understand medically what they can do to help people who are suffering. And you're then pushed into a curriculum that has really been bought by the pharmaceutical industry. And, there's a lot of physicians out there that are critical of our modern mental health care system and our modern healthcare system in general, saying that we have now just become drug pushers, that we are no longer, we've lost our ability to restore health. So I think when you just see the psychiatrists and the psychiatric nurses and the physician assistants, they're basically just became an arm of the pharmaceutical companies, and they're doing quick checklists and quick prescriptions. They're drug dealers, and they're just following rules. And obviously, there's a percentage of people who actually believe that they think that they're doing some benefit, and then there's plenty of people out there who are just questioning whether this has any effect at all. And there's people out there who are even physicians and psychiatrists who are saying this is harming people and want to advance the dialogue and advance the science base. I have a Harvard psychiatrist coming on my podcast next week who has done research in metabolic conditions and changes in diet and how that has helped eliminate symptoms that are psychiatrically treated and have had no effect for decades. So I want to be more optimistic that I think there are good people that exist out there who are willing to advance the conversation, and not just overgeneralize it on psychiatry, because I think we need to value the role that physicians can play in this mental health space, because there are many conditions that present themselves psychiatrically that are medically, their origins are medically. Like I live in an area in Pennsylvania where there's a high rate of Lyme disease, for example, from ticks. And there's many people who will experience psychiatric symptoms, but they actually have Lyme disease. We can look at, a number of physical illnesses that just present themselves with typical psychiatric symptoms. If we don't have good physicians who are willing to take the time to do thorough examinations and run blood tests and consider other disease states, and to provide support and be aware of empirically validated behavioral treatments, like we need these people in our system. And right now, because of really, unfortunately, it comes down to money. You can make a lot more money just seeing 4 patients an hour, 15 minutes, and writing out a prescription than to take a client, spend an hour or an hour and a half with them, and really get to know them and be a physician who really investigates the origins of everything that they are experiencing, mind, body, spirit, and takes the time. There's just a concept of kind of waitful watching, just taking the time of just doing nothing and just listening and supporting somebody, understanding in context that what they might be experiencing on one day is not necessarily permanent, and they just are going through some things, and that's temporary, and everything is dynamic and always changing. And sometimes just doing nothing is better than what they're doing right now. And I had a conversation, with my own brother yesterday because we're feeling a bit frustrated about the system and how do you make change. And I said, I feel like in some respects, just stopping what's being done makes change, right?
Right.
So just no longer having quick diagnoses and a drug treatment improves the situation dramatically.
Right.
And I can say that because of the amount of people that are harmed by those interventions.
Right.
We just have to. I think we don't. We have to find the ethical, the best and the brightest, and those who care deeply about living well. And those people have to have those who are trained physicians then have to have a greater voice, because you're just going to be drowned out by the 90% who are just writing out prescriptions and following the DSM.
Right. And I know that there's a lot of seems to be a movement where there's more holistic psychiatry going on, where they go to the root causes, and and there are biological root causes, as you say. I mean, like, I know personally in the past when I have had these issues where I would stay up and I would go into these like kind of like a recurrence really of what I experienced in India, which was like, I tend to be spiritual in the sense where I connect to a shamanistic tradition. So, a lot of the people who were in these communities, the people who were gifted, who might be able to kind of walk between worlds and then come back with information for the rest of the tribe, they had these experiences, and we're so disconnected from that in a modern way that it looks like absolutely crazy. But when those things were going on and I experienced these things, there was always, where it got out of control was that usually sleep, usually nutrition, usually, me being ruminating. so these things I feel can easily be brought into our everyday if we could just get people on board. And why not? Why not even the psychiatric field incorporate more of those ways of, why can't that coexist with their script? I know that there's other people who are also working on, say, things like tapering strips, okay, for people who want to withdraw from these medications. And, I've been now withdrawing for over a year and a half. And it's taking a long time because I have to do it incrementally, very slowly, 10% of the previous month's dose. This seems to be the thing that they published a study earlier in 2021, where it was like the first of its kind that kind of collected a lot of information from people who were tapering on their own and coming forward with information collected by survivingantidepressants.org. And they basically were able to show that rule is a good rule of thumb. You're not going to experience that many withdrawal symptoms. So but it's 2021. It took all of that time. So I feel as though right about now, I mean, in the course of my life, it hasn't been much movement because there's just been so much like push and pull. But right about now, maybe with the hopes of social media, getting our voices out there, with the hopes of more people wanting or experiencing since COVID a state of mental distress. I felt suddenly when COVID hit, I was like, oh my gosh, like people now get it. They've woken up a little bit. So that was really reassuring for me because I saw, if more people experience this, then it is normalizing it, isn't it? It's much more part of the human experience and the types of things that come up in life. And when there's a lot of us that can come together and say that we all experience it, well, then it becomes less stigmatizing and less, something that those people experience and I'm just fine. So that I feel was a huge switch for the movement, taking kind of more of a front and center where we're asking people to reconsider this for the sake of people's health, not for the sake of, putting people down or destroying careers or for the sake of people's health. This is what we want people to heal, right? I mean, isn't that the purpose?
Yeah, there has been an awakening through the COVID pandemic, no doubt. I think there's, one thing that has, worked against the messaging from the medical establishment is how much misinformation on COVID and COVID treatments and the efficacy of COVID vaccines was presented out there through the media and through the government and through the pharmaceutical industry, which, ended up being just false. And it's almost like, wait a second here, I can't trust everything that's told to me in our modern Western society. Not everything's a conspiracy theory. There's some valid comments and statements and skepticism that should exist as a consumer. And I need to take control over my life. And one of the things you were mentioning before, you're talking about cultural differences that exist in the human experience. One culture might view having a psychotic episode as a symptom of an illness, while another culture could, just frame it as a spiritual awakening.
Right.
And then how you respond to that between the two cultures can actually determine the course. Again, there's humility. There's so much we don't know. There are trials on various forms of like cognitive therapy for psychotic conditions. So just teaching people who have had psychotic symptoms to respond differently to their delusions or their hallucinations. And I know around the world, there's in different cultures, indigenous cultures, you might have like a guide who's experienced something similar. And, just even if you look historically, Native Americans would induce a psychotic episode through fasting and through heat and isolation. So like there's ways that we can induce it. And obviously they believe that provided some form of spiritual awakening and growth. So it's just a reminder to everybody that how we view our mental illness in the United States here in the year 2022 is a modern invention that is culturally defined in Western society. And there's a lot more for us to learn, and there needs to be just more humility and be more open-minded as we start taking steps to try to improve the welfare of our society.
Yeah, absolutely. Ken, before we wrap up, I do want to just elaborate on that a little bit, because there's such a push for a global mental health standard right now. And they are going into a lot of different areas of the world much more aggressively with the drugs. And in areas of places like, say, India, you could get them over the counter. You don't even need a psychiatrist. So, I mean, what's your take on that?
My take is the obvious one. It's the growth of the pharmaceutical industry as the worldwide power.
Yeah.
The money they make is greater than the gross domestic product of most countries.
Yeah.
The pharmaceutical industry in itself has tremendous power over the world narrative. They just here in the United States, obviously the financial aspect of advertising drives, what's consumed by the American public. They own our politicians. It's almost impossible to go up against the pharmaceutical lobby and the industry and be able to have the backing in order to like maintain what is needed in order to be an elected politician in this country. It's connected with a kind of a global kind of narrative or initiative to drive pharmaceuticals for everything. Whether it's the global distribution of vaccines or even psychiatric drugs, taking antidepressants and applying them to all different types of conditions that they've never been adequately studied or tested for. It serves the shareholder. It serves the company. I'm very skeptical and concerned because I'm very aware again of a couple things. About 4% of the population meets criteria for what we call antisocial personality disorder or psychopathy, and there is a tendency for bright, ambitious people who fall in that realm to enter into positions of leadership. And if you can't disconnect from what is throughout the course of history, there has always been an elite ruling class and then the people. And the elite and ruling class can be totalitarianism, brutal control and regimes and dictatorships. And we're not. It's not like we've evolved as a people to kind of disconnect from that. It's not out of the realm of possibility that it just moves from rulers of countries to rulers of industry. Right. So does it sound conspiratorial in some way? To some it will, because you don't want to think about things about that way. But then I would just say you're just conditioned to what you're being told.
Right.
You shouldn't be able to get a mind altering and mood altering drug with significant health consequences so easily.
Right.
But we do. We do. And it's just driving drug sales, and it's not improving the human condition.
No, not at all. Not at all. Well, listen, I am just so thrilled that you were able to come on board and share your wisdom and give my listeners just so much amazing information, because this is something that I feel needs to come from more people like you. Those who have been harmed, we can speak our truths and then we can rally together. But we need people who are within the system who can see the main problem, and see the two sides of it, and be able to, walk that fine line between, understanding that people do want to help in the system and also trying to give maybe people who would be open, professionals in the mental health care system who might be open to change and to incorporate some of these things in their practice, because there's no reason why you can't. And why not improve, the way you can strategize the course of treatment for your patients. So I so appreciate this. Is there any other last thing that you would like to make sure that any people hear?
Yeah, I just think that the time, there is an awakening, and I do think the time is now for people like myself and those who have been harmed in the community and others like me to be able to have a greater voice in this area. Podcasts are a great opportunity to be able to bring people on and to share their experiences and their thoughts, bring experts to talk about this, and for us no longer to rely on what is the mainstream narrative. You can download my podcast, Radically Genuine Podcast, on all major platforms. You can also follow me on Twitter at Dr. McFillin. And we've just this week started a TikTok and Instagram, because social media is the way to get the information out there. At RadGenPod is Instagram and TikTok. And I want to provide a platform for stories. Listen, if you are a compassionate and ethical scientist in any way, whether that is a social scientist, a clinical psychologist, a psychiatrist, or a physician, what is natural to you is a curiosity for learning. And you want to learn from those who our modern day treatments have failed. And so my mission is to have a platform for these people to come on my podcast to tell their stories. And then we then can discuss on where it went wrong. Then we can be very critical. We can be critical of the conceptualization, the diagnosis, the understanding, and the treatment that's provided. And that's how we learn. And if we can support it with experts and other scientific data, we can add legitimacy to it, where it's we have authority biases that exist, so we're going to trust people in positions of authority. I'm just fearful that people who've dedicated their lives to this area and can advance the discussion are being censored and kept out of the mainstream narrative, because it obviously it would have a negative impact on the current model and the current financial model. So hopefully that you can join us, in this mission. Find me on social media, reach out. You can also email the podcast at, it's radgenpod@gmail.com. Or just on social media, comment, connect with us. I know that there's people out there who want to make change, and hopefully we can come together as a community and begin to restore common sense practices here again.
Oh, absolutely. And did you mention your website?
My website is www.centerforibh.com. I'm Center for Integrated Behavioral Health in Bethlehem, Pennsylvania. We're a center trying to be able to take these principles and improve the lives of others. And I feel like myself and my staff are, on the cutting edge of kind of a lot of this. So you can find us there, and you can also learn more about me, the treatments we provide, and our podcast from that website.
Wonderful. And the podcast is great. You're involved with your brother and your brother from another mother, you call?
Yeah. My brother came from Los Angeles to really get this in motion. He has a background in marketing and working in an industry, and knows that in order to be able to advance our center and to be able to advance the message, we have to be able to be marketable and available and get ourselves out. So he's helping us there. He's also a really smart guy who does a lot of research, and I think he's a thoughtful, compassionate person. And Kelly is a former Teacher of the Year, state of Pennsylvania. He's also the producer of our podcast. And he's just been a really good just addition to just having a conversation. And I think when you combine my knowledge and two lay people from different backgrounds, you help learn to communicate to people in a conversational way. And our podcast is new, and it quickly jumped in the top 5% of global downloads. And it's really just us three guys having conversations.
It's amazing.
Yeah. And so now this next year is about getting those experts and guests on to the podcast. And we should have a YouTube channel shortly. And so hopefully we can begin to make a difference in this upcoming year.
Oh my gosh. So everyone, please check in, tune in, check it out. It's great stuff. And it's really and he expands so much more. And it really is what this is about, this new movement, this new thinking. And it's only going to go in a positive direction because this is the way of the future. I really do believe it, because up until now, everything that's been done, it's been exhausted. And we know that what doesn't work. So let's move forward and bring something new to the table. Thank you so much, Dr. McFillin. I'm so thrilled that you were able to be on this show. Really, it's been such a pleasure having you.
I appreciate it, Jen. It was great meeting you.
Thanks for listening to Not As Crazy As You Think, and don't forget to subscribe to my YouTube channel. And remember, mental health is attainable for anyone, especially those labeled with mental illness. Until next time, peace out.